getting pregnant. It is common sense that you are more likely to get pregnant when you are most fertile. In order to maximize your chances of pregnancy, it is important to know the optimum time of the month to have sex. Here are 4 different methods that you can try in order to monitor the best time to get pregnant. Ovulation predictor kits. Many women find predictor kits helpful because they can tell a woman that she is about to ovulate before she actually does. There are 2 main types of ovulation predictor kits, 3 if you count the digital type. The first 2 are very similar and work on the same principles. Every day, after holding your bladder for 3 or more hours, you have to urinate on a stick. You then check for a positive indication. The main difference between the kits is in the reading of the positive or negative result. Some brands have 2 lines to compare. In this type, the first line needs to turn as dark or darker than the control line. The other type is only 1 line. If the test is positive, then a second line appears. With this type of test, any second line is a positive sign. Within 24 to 48 hours after the positive test, ovulation will occur, and this is your most fertile time. Women can use ovulation predictor kits to know when they are most fertile. They can then time sex to ensure that there's an army of sperm waiting at the gate for the egg. Basal body temperature. Basal body temperature is a method that uses a specific thermometer that recognizes slight shifts in temperature that otherwise would have gone unnoticed. The woman must take her temperature after she has been in bed without any activity for at least 4 hours. It doesn't have to be upon waking, just as long as it is the same time every day. During ovulation, the temperature will take a dip, and then it will spike back up after ovulation has happened. This increase of temperature is slight, usually 0.4 degrees. The temperature shift is due to a surge in progesterone. This causes the blood vessels to dilate. This surge will stay and keep the temperature raised until the progesterone levels drop back down again. It will then be 24 to 48 hours before the period arrives. Alternatively, the body temperature will stay up high for 18 or more days, indicating that pregnancy has occurred. In addition, some women may get a minor dip around the time of implantation, and then the body temperature will then shoot back up. This chart will therefore have 3 phases. This minor temperature dip will be very small, and it will not be as low as the temperature drop that indicates ovulation. What the basal body temperature method will tell you is that you did ovulate, but after the fact. It will prove to a doctor whether or not you have a fertility issue related to ovulation. The basal body temperature cannot be used to identify the most fertile days. It is just a confirmation that ovulation did or did not happen. Cervical mucus. A woman's cervical mucus changes frequently throughout a cycle. All women have different amounts and kinds of mucus before and after ovulation. Cervical mucus tends to be white, creamy, and thick. It can also range from dry and flaky to wet like a lotion. There is no right or wrong type of mucus. It is unique to each woman and each cycle. Around the time of ovulation, the mucus will become more abundant and become thinner. Some women will get a clear, slippery, and stretchy egg white type mucus. Other women will get an increased volume of slippery and thinner white cervical mucus. Either way, this process is normal. Mucus is not a good way of monitoring fertility because it is not always the same for each woman or for each cycle. It does not necessarily predict ovulation. As long as the mucus has become thinner and increased in volume, this is normally your ovulation time. Some over-the-counter cold medications can cause the mucus to thin and have even been said to assist in the mobility of sperm. Fertility monitors and slides. These devices are high-tech, and to use them, you must be very careful to read and follow the directions. You must understand what the words on the monitor mean, and what the proper pattern should look like. These are actually the most reliable ways to know when you are most fertile, but are not very easy to use or interpret properly. Some women can get extremely frustrated trying to use them, but others swear by them and would use nothing else. So if you are great at following directions, this could be a great approach. Find it hard to get pregnant? If you are having difficulties with fertility, you might like to try one of these methods before spending thousands of dollars on fertility treatment. If you are still not conceiving or do not fully understand how to predict your ovulation, then you should speak to your healthcare provider. If you have found this video helpful, then visit our website now, www.gynecpregnant.com. Thank you for watching.